Hi, these are anatomy and physiology videos for healthcare students. This one covers directional terms. So let's talk about what are directional terms. Directional terms give us an idea of relationships between body parts. So if you're not entirely familiar with a name for a particular body part, you might say, well, it's above the elbow or it's below the thumb. These kinds of directional terms give us an idea of where another body part may be located. We use these all the time when giving directions from our home to a nearest grocery store. We use information and directions such as turn left, go north, right, south, east, and west. All of these are directional terms that have to do with our geography. Well, we have them for the human body as well. So we need to understand one thing before we dive into directional terms, and that is anatomical position. Anatomical position is a frame of reference used by healthcare professionals. When we talk about this frame of reference, we understand the human body to be standing erect, feet and palms facing forward, thumbs pointing lateral. So when we talk about left and right, front and back, we're thinking about the human body being in this frame of reference, this universal position used by all healthcare professionals known as anatomical position. We're going to talk about these terms as opposites. Let's start with a pair here called superior and inferior. Superior means toward the head. This just means that we are heading up on the body toward the direction of the head. Inferior means away from the head, or it means toward the feet. So these terms are used opposite to one another. Just like you would use north and south as opposite directional terms for driving on a street, superior and inferior basically do the same thing for the human body. You can substitute the word above and below for superior and inferior, and if you're not quite sure which term to use, above means superior and below means inferior. Let's talk about anterior and posterior. So anterior is the face or belly side of the human body. Keep in mind, we are thinking in anatomical position. The posterior side or dorsal side is the back or the butt region of the body. The reason I'm mentioning that there's two portions here is because we walk on 2 feet. If you're thinking about an animal that walks on 4 feet like a dog or a cat, the face, belly, back, and buttocks are actually on 4 different surfaces of the body. But since we walk on 2 feet, our face and belly are both anterior and ventral, and our back and buttocks are on the posterior or dorsal side of the body. An easy way to keep this straight would be a dorsal fin for a shark. That is on the back side of that animal. So on our bodies, our belly button, our face are anterior. On our backside, our spine, our buttocks are posterior. So let's talk about medial and lateral. These are yet another pair of opposite terms. Medial means toward the midline of the body. That is an imaginary line that divides us in half. It runs right down your nose, it runs down your breastbone, by your belly button, and then of course it splits the legs in two. So this is a line, an imaginary line, that runs down the middle of your body on the front side. Lateral means toward the sides or away from the midline. So if you're looking at anatomical position, we might think of our shoulders as being lateral. Our breastbone, for instance, or sternum is considered to be medial. Proximal and distal are again two more opposite pairs of terms. We often use these for arms and legs when we're just starting to learn about anatomy and physiology. But as we get more into the depths of this type of material, we may start applying it to other things, such as the distal end of an intestine or the proximal portion of a bone. So for now, we oftentimes refer to these as attachment points for a limb. Either you're close to it and proximal to the attachment of the limb to the body, or you're farther away or distal. Let's use these terms first with an analogy. I want you to think of where your nearest grocery store is relative to your home. If it is close by, it is proximal. Proximal means closest to the point of attachment of the limb to the body. Distal means farther away. So distal means a distance from the point of attachment. If you're thinking arms and legs, proximal and superior are interchangeable. Distal and inferior are interchangeable. Let's do an example. So the shoulder is superior to the elbow. That means it's above the elbow. You can substitute the term proximal. The shoulder is proximal to the elbow. That means the shoulder is closer to the point of attachment than the elbow. Let's flip it. Let's do another example. The ankle is inferior to the knee. That means it's lower on the body or further from the head than the knee. Let's now insert the word distal. The ankle is distal to the knee. That means the ankle is further from the point of attachment of your leg to your body than is your knee. So just keep in mind, if you're struggling to keep proximal and distal correct, just substitute superior or inferior, and then, of course, you can get them correct. Superior and proximal, you can interchange. Distal and inferior, you can interchange as long as you're talking about arms and legs. Deep and superficial are yet another pair of opposite terms. Deep is toward the organs or internal organs, while superficial means toward the surface, like the skin. So if you think about the way the body is created or built, our internal organs are protected by bones, muscles, skin, that all sit superficial to those deep internal organs. So let's take a look at these labels here. On the first pair, letters A and B, we are looking at toward the back and toward the front. So what term best describes toward the back side? That is posterior or dorsal. For letter B, what terms describe toward the belly or front side of the body? That's anterior or ventral. Let's look at letters C and D. Notice these are pointing toward the head or toward the feet. Which term means going toward the head? That's superior. Which term means toward the feet? Inferior. Now, looking at letters E and F, notice that as we move toward the midline, that would be letter F, and we move away from the midline, that would be letter E. So medial is toward the midline, that's F. Lateral is toward the sides of your body, that would be letter E. Let's work on some practice problems. You may want to pause the video at this time, take a moment to write down your answers, and when you're ready, you can go ahead and then continue playing the video. Let's do answers. So for the very first question, the wrist is blinked to the elbow. What we're trying to do is describe the relationship between these two body parts. There may be more than one correct answer. So what'd you come up with for this one? One thing you could say is the wrist is inferior to the elbow. That means it's further from the head than the elbow is. Or you could say it's closer to the feet than the elbow. Since inferior and distal can be used interchangeably on arms and legs, let's also place distal as a possible correct answer. Let's talk about the nose relative to the sternum or breastbone. One thing you could say here is the nose is above or superior to the breastbone. Both are medial, so you would want to avoid using a term that is the same for both. If the nose is medial to the sternum, then I'm assuming the sternum must be lateral. And that's not the case. Both are sitting along the midline of the body. The next term there, the hip is blinked to the ankle. There's two potential answers here. You could say the hip is superior, meaning it's above the ankle, or if you're using the word proximal, you're saying that the hip is closer to the point of attachment for the leg to the body than the ankle is. The eyes are lateral to the nose. They are further away from the midline than the nose. They also sit superior to the nose. Either of these directional terms could describe the relationship between the eyes and the nose. What about the relationship between the mouth and the nose? Well, you might say the mouth is inferior to the nose. What surface is the ear on? It's on the side of the head, so you might say it's on the lateral surface of the body. Again, you may want to pause this video, take a moment to write down your answers, and when you're ready, restart the video. All right, let's do the answers. So for the first question, the heart is where relative to the rib cage? It is deep. That means it's closer to the internal organs than it is toward the surface. You could rearrange that sentence and say the rib cage is superficial to the heart. The skin, however, sits on top of or closer to the surface than the muscles, so this time we'll use the term superficial. Superficial meaning toward the surface. Let's think about the belly button or navel. The belly button is in the midline of the body, so we could say it's medial. The hip is sitting on the side of the body. So the assumption here is the navel is medial to the hip. You could also argue that the navel is anterior, meaning it's closer to the front. The hip kind of sits on the side. So medial is probably our best term, but anterior would also be correct. The next one, the spine, is what to the sternum? Well, both are in the midline. I would avoid using medial or lateral here. I would use a term that illustrates how they're different. So the spine is on the back of the body compared to the sternum on the front of the body. So I would say the spine is posterior or dorsal to the sternum. So what is the ear lateral to? It is on the side of the head compared to anything that might be sitting on the front of the head. So you might come up with something like the mouth, the nose, even the eyes. We know the sternum is medial. What is it medial to? It's something that's lateral. That could be the shoulder. That could be the collarbone, for instance. Let's do one last set. I'm going to pause, let you pause the video here, work through these, and then when you're ready, restart the video and let's go over these answers. All right, let's do the answers. In anatomical position, the thumb is pointing lateral. That is the normal position for it. It should be pointing out toward the side because your palms are facing anterior. For the next question, the knee is distal or farther away from the hip. So considering the leg is attached at your hip to your body, that's about the only other answer we can pick there. So the knee is distal to the hip. The nose is on the anterior surface of the body. And for the next one, where are the vertebrae relative to your skin? They are deep. That means they are closer to the internal organs than is your skin. The lungs and the heart are both deep. So to understand how they're related to each other, you might say the lungs sit on the sides of the heart. To say on the sides would be to say they are lateral to the heart. You can rearrange this sentence to say the heart is medial to the lungs. And finally, the head is superior to the neck. That means the head is above the neck. I hope you enjoyed this video. If you liked it, please follow this channel. And if you'd like other videos to be made, please make that known in the comments. Thank you for watching.